Hi, I'm back again. When I was doing the video, I was interrupted. As you can see, I have changed my clothes, so this is not the same day. I decided to finish the video today because I've not said the main thing that does the job. Yes. First, you need this table salt. This is salt. Yeah, this is salt. You need salt. First, you need this table salt. Any salt of any kind, as far as it's salt. That is the first thing. Then the second one is dates. The second one is this. This is how it is. See, this is the one I used. This is the one I used, so that's why it's like this. It's almost finishing. This is it. It's coming out. So this is it. So you need this. You need this. This is hydrocortisone. Don't know if okay. Hydrocortisone cream. If you can get cortisone, then that's okay. But for my side, this is what I can get, and this is what I used. This is hydrocortisone cream. This is how it's look. I've already used this one. Don't know if you are seeing this clear. This is how it looks. Then you need this one. This is another thing you need. This is cotton board. This is cotton board. I don't know what you people. I don't know what some other people call it, but this is what I call it. Cotton board. This is how it looks. This is it. So what do you have to do? What do you have to do first? After you have performed your seed baths and you have dried up that place, don't rough handle that area. Don't rough handle that area. You need to handle it gently, pat dry gently. Then after that, you can sit in a position that you can be able to see that area. Maybe you will use a mirror. If you can use mirror, then use mirror, because mirror will make you to get the exact place so that you not apply it in the wrong position. Then what you have to do, just look for something like a bowel, like a cover, like a cover, or something that you can put this salt. Then scoop, let's say half, or maybe small, or even if it is not up to half, that's okay. When you put small quantity on that plate or a cover, then add tiny water, because that water will make it to stick. If you apply it, add a tiny water so that it will still be thick. It's not going to be watery, it will be very thick. Just tiny water that will just hold the salt together. That's what you need. Something that will hold the salt together. That's what you need. Then when you add that tiny water, then use this cotton board. This thing now, this cotton board. Let me say the salt is in my hand now. You use the cotton board and collect the salt. Then let me say this is where I have put in the salt. Let me say this is salt. Then use this cotton wool, collect the salt. Then with that mirror in front of you, apply the salt on top of that granulation tissue. Apply that salt on top of it. See, this is not going to be sweet, but you can enjoy it, because I'm someone that don't like something that is painful, but I was able to handle it. So I believe you also can handle it. It's painful, but that surgery you're going to perform is more painful. So you better do this one, because this one is painful, is minimal. You can handle it, you can control it, and at the same time, it will do the job perfectly. This is what I did. I'm talking out of experience. I am not here to say they said or somebody said. This is what I did, and it worked. It worked very well. It's really worked. It was a miracle. I was surprised. It was gone forever. That hypergranulation tissue was gone. I did it like up to 2 weeks before it was gone, because when when I was doing it, I was checking it to see the the result. So the result was coming day by day, day by day. I was applying it until the day it was gone forever. I could not see it again. Everything, I am healed, I am okay, everything is gone. When I mean everything is gone, everything is gone. There is a lady that made this video that made me to know that this thing works, but this is not what she used. She used a cortisol. Yeah, because it's like she's in another country. Maybe I don't know which country she is from, but me, this is what I can get in Nigeria. They work the same. Yeah, it's the same thing. Maybe the other one is, I don't know sure, but it's the same thing, because if you can't get that one, get this. It's the same thing. So after applying that salt in that area, I collect the salt, then use the mirror. Then I was able to place it on top of that granulation tissue. Then when I did, it will pain you for that moment. The pain will subside. The pain does not last. Just for that moment you applied it, it will pain you. Then for some time it will stop. Then you will use cotton wool. Use cotton wool, or you can get more of this, because when you apply that salt, water will be dropping small small from that granulation tissue, from that wound. So you have to use this. You have to use this to absorb the water, or you can use cotton wool. Yes, after absorbing the water, when you apply that salt, allow it to stay there for like 15 minutes to 20 minutes. Yes, 15 minutes to 20 minutes, or sometimes you can choose to maybe leave it like up to 10 minutes, but it's better to 15 minutes highest. Then if you can do it up to 20 minutes, that's okay. Then after that, after cleaning it, drying it, then you can now apply this cream. This thing is not showing. You can now apply this cream. Let me show the carton, maybe you can see it very well. This is hydrocortisone. Then you can now apply this cream. Then you will still use this. You use this. After using this, please throw it away. Then use this to take this cortisone, take the cream, then apply it. Then make sure you apply it in that position. Don't allow it to enter your VJ area, because it will not be nice. So don't allow it to touch there. Just only focus on that wound only. Apply it there. Yes. They said that this is for external use. This is used for treating, I think, skin problem. Because when my child was having like something on his head, they said the doctor gave me this to apply on it. So it is meant for the skin. Yes, it is not meant for the internal, it's for the outer body. This is meant for the outer body. So this is what I used. I applied it after rubbing the salt, then leaving it for 15 to 20 minutes. I will wipe it off, clean that area with a cotton wool, something very neat, or this cotton ball. Then you can now apply this cream. Apply the cream. Then when you apply the cream, you can wear your clothes. That's all. Until the cream clean on its own. You don't need to, unless you bath, it can go away. Maybe you bath, it can go away, or it can clean by itself. Yeah, but just apply it, then leave it. If you feel uncomfortable, maybe like after an hour, if you feel uncomfortable, you can clean it away. I believe by then it has done its job. So this is it. This is what I used. Jesus. The thing I thought that I don't even know how to describe how I feel when I find out that I have this. Oh my God, I was in so many pain. When I walk, if I try to walk, I will be in pain. If I walk for a while, if I trek, maybe I trek for some minutes, I will be in pain. If I'm doing something, the pain will come. Oh my God, it was very painful and uncomfortable. And I was scared to go to hospital because I don't want to pass through that pain I passed before, that I experienced before. I don't want to pass through that pain that I experienced before, because going through episiotomy, sewing you and all of that is not easy. It is not a child's play. So now you are having that granulation tissue, which is another thing on its own, which can cause you pain. So I believe by doing this and praying, if you know how you pray, you can call God Almighty, you can believe in God, trust Him, pray that through this you will be healed, through this you will be okay. And I believe it will work for you as you do it and you believe, yes. And also, without much, I will say that please, it is good to seek for doctor's advice. This is not a medical advice. This is what I did. I'm here to share my life experience. I'm here to share what I have done in my life that have helped me, both in other areas, both as a mother and also as someone who have experienced some certain things in life, especially health and other areas. I'll be touching it. I'll be saying the things that I know in my channel so that others will learn from me. I'm doing this to tell people out there who need this information, who need help, who don't know what to do. Yes, I'm here to let you know and tell you what I did that worked for me, and I believe if you do the same thing, it will work. Please, if you have anything that you are concerned that you know that this thing can stop you from doing this, please don't do it. Please ask your doctor first. If you have any health issue that you know that is complicated, please ask your doctor. This is not a medical advice. This is what I did that helped me. Tested and trusted. Yes, I did it and it worked. So, and I believe it will also work for you. Thank you for watching. God bless you. Angel. If you learn anything or you would like to stick with me to learn more, please don't forget to subscribe, share, and do the rest. You know what to do.